Welcome to sunny California. This is CCN channel, Connect Care Network channel. This is Consumers Doctor, Dr. Bengala, a nonprofit establishment to educate the public how to empower yourself in healthcare. I'll give you all the tips needed to empower yourself. Lately I've been seeing more and more African Americans. I just went to the Home Depot. I met an African American. He has 3 homes. He wants to retire. He's working. He's 62. He wants to retire in 5 years. That's an American dream, folks. People want to retire in their 50s. That's the American dream. That American dream is still alive, folks. The other day I met another African American. He's right in my neighborhood. He has about 4 houses. He's so busy with those houses. He's empowered to take care of themselves and generating revenue. He's retired. He doesn't need any help from anybody. He probably has a Medicaid, so he doesn't need a help. So what I'm saying is, American dream is still alive, folks. I want to achieve that dream in healthcare. Healthcare insurance is no different from house insurance, folks. This is an asset. This is your asset. You need to get the best premium possible. The price transparency which present administration has advocated, there are 2 big things. One is the insurance. The second one is hospitals. So insurance companies, we still haven't, I think they have to go through the health insurance reform. But hospitals, federal government has won the case. So from January 1st, they have to disclose the prices, folks. They have to disclose the prices. And American consumers make a choice what they want. Coming back to the healthcare, what have we achieved so far on kidney care? There are a lot of chronic conditions. Telehealth is one good thing, which the government has removed the restrictions on, which is really going to, going to empower the consumers. They can, and prices. The doctors who are price transparent, they'll get more patients to see right from their own home. They don't need to have an office, and patients can see their doctor right from their home. And patients with chronic illnesses, they could be treated right online, especially for chronic illnesses, folks. And overall illnesses wise, overall sickness wise, if you really look at the entire portfolio, 30% of the illnesses go to see a doctor. They're psychosomatic, folks. It's because of the stress, day-to-day stress. They get a shoulder pain, neck pain, back pain. This is all psychosomatic. They can be treated online by the telehealth. Doctors are right there, and they can help you, give you prescriptions. You can pick up your own generic drugs. This is a blessing, folks. This is especially with chronic illnesses, diabetes, hypertension, congestive heart failure, chronic heart conditions, breathing problems. You can check your pulse, right from your fingertip. You can check your pulse and your blood pressure, everything, right on your phone, and you can check your temperature. Give the data, vital signs to the doctor online, and certain things. You can even check your heart murmur. If you have a guy, they can listen to your heart murmur and tell you what kind of a heart condition you have. This is a technology, folks, and it's empowering the consumers. Coming back to the kidney care, this present administrations, what they have done is kidney care. What it is, they're coming back to the thing is, number 1 in kidney care, government has removed the restrictions on transplants. So anybody who gets a matching donor, number 1, they can get kidney transplant so they can get off of the dialysis. And the ultimate goal is to reduce the cost of the transplant. That is an ultimate goal. That's number one. So people can see chronic dialysis is most expensive thing, and it is draining our resources, folks. There are a lot of people, they don't need to be on dialysis. There are a lot of ways to get off of the dialysis. Nobody tells you that. Nobody. Even if you go to a nephrologist, they'll say, oh, okay, you need a dialysis. Come on. There are ways to be not on hemodialysis, so-called, they take the blood out, filter it. So that's number one, transplant. Second thing is, this one you will not hear from anyone, because there's a home dialysis, folks. You can literally, while you're sleeping, you can receive a home dialysis. It's called peritoneal dialysis. It's simple, folks. There's a little catheter. You put the fluid in your cavity, and it takes out all the bad urea and ammonia products out of the system. Next day you're up and about. You really don't need a hemodialysis. You don't need a shunt. You don't need anything. Being a urologist, I'm telling you, because I have advocated to my patients over and over. But the folks they need to be educated. Consumers need to be educated. Peritoneal dialysis is a lot cheaper than having 3 times a day dialysis. It costs about $500, $600, $700. God only knows how much they charge. But you don't need that. You can have it done at home. And you can have a home nurse can visit. And your family member could be a nurse. They can be trained. This is where the beauty is. Dr. Shetty, he's doing heart surgeries. And in the hospitals, he's training the family to take care of the patients. In the hospital. I'm not talking about home. In the hospital. So the patients' families can take care of them at home, in the hospital. So you don't incur the cost. That's one way. There are a lot of ideas how to keep. He does the heart surgery, open heart surgery, for $800, folks. Here in this country, it cost prohibitive, $200, $300, you name it. It's just not justifiable. So number 2, home dialysis, which is there are a lot of technology has come on home dialysis. And number 3, artificial kidneys, folks. We have a technology. If we can do a pulse ox, if we can do you can do an EKG through telehealth, why can't we do? Basically you need a little gadget. Same thing like what diabetics. Nowadays they can monitor their own sugar, they can inject their own insulin based on the sugar level. Same thing. You have a gadget size of your cell phone. You can probably either carry it externally, or it could be, again, when you say implant, that, cost goes up. You can have an external device hooked up, put it in your pocket. It dialyzes your blood. It's there, folks. Let's explore the technology and bring the healthcare cost down. Again, I just want to make it more than 8 to 9, 10 minutes segment. So if you like the channel, subscribe to CCN channel, Connect Care Network, Consumers Doctor, Dr. Bengala, a non-profit establishment, and will help average folks like you, educate them, ask me questions. Go to my website, Connect Care Network, ask questions. I will address as much as I can, and I'll help you educate. We will see you in the next episode. Thanks for joining.